Hello students, today we will discuss about the osteology of sternum. You know that sternum is the anterior bone in your chest wall. So today we will discuss the osteology, we will see the bony features, we will see the attachments related to the sternum. So dear students, whenever you are having the sternum is an example of the flat bone. So this is the first question, that sternum is an example of. Answer is flat bone, because when you will have the general anatomy, you have a type of different bones and you have one type is flat bone. Now the second question is that it is located in the median part of the anterior chest wall, and sometimes you have the question related to the size. It is roughly around 7 inches long, or you can say 17 centimeters long. Now it is mainly made up of spongy bone, and this is again the important concept, that because it is having the large amount of the spongy bone, so this is a common site to procure the red bone marrow. Clear? Now the second thing is that whenever you are having this sternum, now this whole sternum is having the three part. Now this upper part is known as manubrium, this part is known as body, and this last end or the tip is known as XIPHOID process. So my dear students, this is a question again, that what is the name of the bone? Most of the student writes manubrium, some will write the body, but the whole bone is actually known as sternum, and sternum is having the three different parts: manubrium, body and XIPHOID process. Clear? So now we will see that when you will have the sternum as a whole, what are the bony features you will have first. So my dear students, when I am having this bone in my hand, first thing is I will see the suprasternal notch. Now when you will see this area between the two clavicles where you can put your finger is known as suprasternal notch, or it is also known as jugular notch. So where it is? Now this is your area where you can see that you will have this notch. So this notch is known as suprasternal notch. Then you will have clavicular notch. Now clavicular notches are present on both right and left side, and these notches provide attachment to the medial end of clavicle to form the sternoclavicular joint. Now what are the other features? Now when you will go downward, you will have a joint, and this is a junction between the manubrium and body of the sternum, and this junction is known as sternal angle or the angle of Lewis. Now apart from that, when you will see the side of the sternum, you will find multiple facets. Now these facets are related to the first, second, third, fourth, sixth and seventh costal cartilages. So here you have this question in your mind, that we don't have the facets for all the 12 ribs. The 11th and 12th rib are the floating ribs, and remaining 8th, 9th and 10th rib will go and they will join the upper rib. They will not directly approach the sternum. So here what you are able to understand, that this is your first rib. So here you will have this notch for the first costal cartilage. Then you will have this notch, and this notch is for the second costal cartilage. Because ribs never directly articulate with the sternum, you have a cartilage, and with the help of this cartilage, the rib approach to the sternum. So you will have the notch for the first, second, third, fourth, fifth, sixth and seventh. So these are the 7 notches for the costal cartilage which are present on the sides of the sternum. So my dear students, these are some basic questions for your exam. Whenever you are having the sternum in your hand, the first question is, what are the parts of the sternum? So manubrium, body, XIPHOID process, and how many costal cartilages notch are present? Answer is 1 to 7. Clear? Now the next part is that we will see the manubrium, body and XIPHOID process separately. So first we are talking about the manubrium. Now you know that manubrium is a broad upper part of this sternum, and this manubrium is also known as pre-sternum, or it is a upper part, that's why it is known as episternum. Epi means the area which is uppermost. So this is the uppermost part of the sternum. So that's why this is also known as episternum. Clear? Now it is wider as compared to the lower part. This is wider in the upper part. Now when you will see the surfaces, borders, you will see that this is having the anterior surface and the surface which is facing inside is the posterior surface. Then you will have the four borders. This is the superior border, this is the inferior border of the manubrium. These are the right and left lateral borders of the manubrium. So let's discuss the surfaces and border one by one. So first is the anterior surface. Now dear students, this is the anterior surface of your manubrium, and when you will see the anterior surface, you will find that it is giving origin to the two muscle. One is the pectoralis major and another is the sternal head of sternocleidomastoid muscle. Now you know that this is a big oblique muscle on your side of the neck, and this muscle is known as sternocleidomastoid, and this is having the two head, sternal head and the clavicular head. So here in this image, what you are able to understand that this is your manubrium. Now from this you can see there is a attachment of this area, and this is your sternal head of this muscle, and here you can see this is the origin of the pectoralis major muscle. Now remaining origin comes on the body, and right now we are talking about the manubrium. So you can see that this anterior surface of the manubrium and this upper part of the anterior surface of manubrium, these two areas are giving origin to the sternocleidomastoid and pectoralis major muscle. Now when you will move to the posterior surface or inner side of your manubrium, you will find that this is going to form anterior boundary of superior mediastinum. Now what is the superior mediastinum? You know that at the level of the sternal angle, we can draw a plane, and this plane is posteriorly passes to the intervertebral disc between the T4 and T5 thoracic vertebrae. And this plane which is passing through this sternal angle, or you can say the junction between the sternum and manubrium, this plane divide this mediastinal area into the superior and inferior mediastinum, and anterior boundary of your superior mediastinum formed by the posterior surface of your manubrium. Now the another important thing is that this posterior side of your manubrium give rise to the origin of two muscles, sternohyoid and sternothyroid. Now when you will see the strap muscles in your neck, you are having the muscles like sternohyoid and sternothyroid. Now in this image you can see that this is your hyoid bone, and below the hyoid bone this is your thyroid cartilage. Now here in this diagram you can see a muscle which is coming deep and it is going into the neck, approaching to this hyoid bone, and this muscle is your sternohyoid. Now if you will cut this sternohyoid, behind that you will find one more muscle that is going from sternum to this thyroid cartilage is sternothyroid. So let's see these muscle in this video clip. Now here what you are able to see that this is your manubrium. Now from the manubrium deep to this area you are having the exit of these two muscles. Now here you can see these are the two layers of the muscle. One muscle is approaching to the hyoid bone. This is coming from posterior side, and this is your sternohyoid. Now deep to the sternohyoid you are having one more muscle which is coming from the posterior surface of the sternum. It is again ascending into the neck, approaching to the thyroid cartilage is sternothyroid. So from the posterior side you are having the origin of two muscles, and these both muscles are ascending into the neck. The superficial one is sternohyoid and the deep muscle is sternothyroid. Clear? Now posteriorly, when you will see the relations, you will find there is a presence of the relation with the corresponding parietal pleura. Now this is the image where you can see that these are the two pleuras which are present in the left and right side, and this is your manubrium. Now, when you will draw the relation on the posterior side of your manubrium, you have to consider that the corresponding half of the manubrium posteriorly related to this area, which are known as parietal pleura. In the coming part of this lecture, I will show you a small video clip for better understanding of the relations of the sternum with pleura. Now, what are the other important relations? Now, my dear students, when you will cut the manubrium in the dissection and if you will remove it, you will find that behind the manubrium posteriorly you will find some vessels, and these vessels are important for your exam purpose. So, what are the vessels come in the relation to the manubrium posteriorly? In that, if you will see, in lower part you are having a relation with the arch of aorta. Now see, this is again a conceptual thing to understand, that you know at this level, which is known as sternal angle, your arch of aorta begins at this point. It will take a posterior course and then it will descend as a descending aorta into the posterior mediastinum. So definitely this is the level where the arch is starting and arch is ending, and this arch, as soon as it will start, it lies anteriorly behind this manubrium. So the manubrium is not related with the ascending aorta, it is not related with the descending aorta. Now the concept is that we know above the sternal angle we have the manubrium and above the sternal angle we have the arch of aorta. So the ascending aorta should come here, not above this plane. Clear? So this is the first important concept. Now in the upper part, now what will happen? This arch of aorta will give the branches. Here you can see this is the brachiocephalic trunk. So brachiocephalic trunk, or you can say the brachiocephalic artery, is in the relation. Then you will have the left common carotid artery. So this is the left common carotid artery which will come here in the relation, and the left subclavian artery that will go like this. So my dear students, here if you will draw the blood vessel in the superior mediastinum, you will realize that they lies just behind the manubrium. What are these? This is the arch of aorta and the three branches, brachiocephalic artery or the trunk, then this is the left common carotid and left subclavian. Apart from that, it is also related with the left brachiocephalic vein. So left brachiocephalic vein is related, not the right. Why? Again you have to understand here that you are having the formation of superior vena cava here, and superior vena cava is formed by the fusion of left brachiocephalic and right brachiocephalic, and then this superior vena cava will go downward and it will open into this right atria. Now here you may ask this question, that is the superior vena cava also a relation with the posterior surface of the manubrium? Answer is no. Why no? Because superior vena cava is little bit posterior to the aorta, plus the important thing is that this right brachiocephalic also not related, because as soon as the right brachiocephalic approaches this posterior part of the clavicular notch, at this point it will meet with the left brachiocephalic. So left brachiocephalic vein is longer than the right brachiocephalic, and then there is a formation of superior vena cava. Clear? So superior vena cava is not a midline structure, it forms on the right side. That's why the left brachiocephalic is longer and it has to run behind the upper part of this manubrium. So what are the relations? In the lower part, here you will have the arch of aorta, and in the upper part you will have the branches of the arch of aorta, that is brachiocephalic trunk, left common carotid, left subclavian, and in the upper part you have the relation with the left brachiocephalic vein. Now in this video clip, you can see that this is your manubrium and you can see that this is your heart. Now here, if you will see from above, what you are able to see that this is the right brachiocephalic, this is the left brachiocephalic vein, and both veins are joining here at this point to form the superior vena cava. But if you will remove this manubrium, you are able to understand that superior vena cava is little bit posterolaterally on the right side, and arch of aorta starts from here and it lies just behind the manubrium. So if you will remove the sternum, the things become more clear that this is your arch of aorta and this arch is going like this. Here you can see this is the arch of aorta, and here you can see that the left brachiocephalic vein is longer as compared to the right, and that's why this left brachiocephalic come in contact with the sternum. Along with that, here you can see that this is the arch from where you can see the branches. This is your brachiocephalic artery, this is your left common carotid, this is your left subclavian. So all these three arteries and the anteriorly placed this longer left brachiocephalic vein, all these relation, and this is the your arch of aorta. Clear? Now we will talk about the borders of the manubrium. First we will discuss the superior border. You know that superior border is thick, and on the superior border you have a notch is known as supraesternal or the jugular notch. So where is the supraesternal notch? Now this is your supraesternal notch, which is also known as jugular notch, and on the sides of the jugular notch you are having one more notch, and these notches are going to form your sternoclavicular joint, so they are known as clavicular notch. Now the supraesternal notch give attachment to the investing layer of the deep cervical fascia and interclavicular ligament. So for that you can see here that this is the investing layer of the deep fascia in the neck, and when you will trace the investing layer in the midline from above downward, you will see that this investing layer is going downward and it will get attached here on this upper border of the sternum. Along with that, in this area you are having these two bands, one is this band, one is this band. These are known as interclavicular ligament. Clear? Now what about the inferior border? You know that inferior border is going to form a joint with the body of sternum, and this joint is known as sternal angle, or it is also known as angle of Lewis. Now why it is known as angle of Lewis? Because it is having a little bit forward angulation. So this is manubrium, this is the body, and between the you have a forward angulation, and this forward angulation is known as angle of Lewis. So sternal angle or angle of Lewis is nothing but it is a manubrio-sternal junction between the manubrium and the body, and this is a very important landmark for the counting of ribs. Why? Because here you can see that this is a costal cartilage which is second. This is the first, this is second, this is third, this is fourth, you will go downward. So first you have to identify this sternal angle by palpating the anteriorly, and when you will palpate anteriorly you will find some elevation around 4 to 5 centimeter below the jugular notch, and from this elevation if you will go side, now if you will go on the side, I have to make sure that it is a second rib and it is a second costal cartilage. So from the second you will go downward, but you cannot go vertically down, you have to go into the mid axillary line. So it is a very important landmark, that is the sternal angle, and this sternal angle provide attachment to the second costal cartilage, and here you can see that half of the facet is in the manubrium and half of the facet will go towards the body. Now what about the lateral borders? Now when you will see the lateral borders are having 1.5 facet. This is a complete facet for the first costal cartilage and the half facet or demi facet for the second costal cartilage. So here you can see this is the complete facet, and if I am talking purely about the manubrium which is above this angle, you can see this is the half facet. So it is having 1.5 facets for the costal cartilages. Now there is a very important question. Now what is the name of this joint? Now this joint is between the costal cartilage and the sternum. So these joints are known as chondrosternal junctions. Clear? What is that? Chondrosternal junctions or the joints. And this first joint is a primary cartilaginous joint. The first joint, that means the joint between the first costal cartilage and manubrium, is a primary cartilaginous, while remaining joints between the corresponding costal facets and the costal cartilage, these all are the synovial variety of joint. So my dear students, you have to understand this question, that what is the difference between the first joint and the remaining joint between the sternum and the costal cartilages. The difference is that first joint is a primary cartilaginous Remaining are the plain variety of synovial joints. Now we will move to the body of sternum. Now dear students, when you will see the body, it is the longest part of your sternum, and this is again having the two end. This is its upper end, this is known as the lower end. It is having the two borders, it is having the two surfaces. Now if you will see this whole body, you will find that body is widest in the lower part as compared to its upper part. Now what is the anterior surface of the body? Now this is the anterior surface of the body, and when you will see the anterior surface, you will find that anterior surface is having the three ill-defined horizontal ridges. So when you will see the sternum in your dissection hall, you will find some kind of the ridges, and these ridges are more pronounced on the anterior surface as compared to the posterior surface. So these ridges are helpful in the identifying the anterior and posterior surface. Whenever you are having the sternum in your hand, if you will find these ridges, compare it on both sides. The side where you are having more prominent ridges is the anterior surface, because on the posterior surface they are not well defined or they are not much prominent. Now these lines actually represent that this sternal body formed by the four segment. So this is the first, second, third and fourth segment. All the four segments fuse together, and the line of fusion appears here as a transverse ridge. So this one segment is known as sternebrae. Like vertebrae, it is sternebrae, and how many sternebrae are there? 4. And these sternebrae are actually shows the line of fusion, and these are represented by the transverse ridges which are appear on the sternum. Now this surface give origin to the pectoralis major. Now we know that pectoralis major arises like this. It is on the one side and here on the second side. So this is the right side pectoralis major, one side you have the opposite pectoralis major. Now the posterior surface of the body, if you will see the posterior surface, as I already told you, transverse ridges are very less prominent. So how to differentiate the anterior and posterior surface of the body of sternum? The most important criteria, you have to look for the transverse ridges. If the transverse ridges or the transverse line are prominent, then it is the anterior surface, and if they are less prominent, it is a posterior surface. So you have to look for both anterior and posterior surface simultaneously. The lower part of this surface give origin to the transversus thoracis muscle, which is a muscle of your chest wall, and it is also having the posterior relation with the lungs, pleura and pericardium. So let's see these things one by one. So my dear students, when you will see the posterior surface, the relation of the lung, pleura and pericardium is different on both right and left side. So this is a very commonly asked question in your spotting, viva and your MCQs, that what is the difference between the posterior relation of the body of sternum in right and left side. So when you will see the relation on the right side of the median plane, what you will find that on the right side the posterior surface is related to the anterior border of the right lung and right pleura. So if suppose if you are drawing the posterior relation on the right side, here I already told you, you will have the relation with the right pleura on the posterior surface of the manubrium. Simultaneously, you will have the posterior relation of your pleura and lung on the right side. But when you will move on the left side, the upper two pieces of the body are related to the left lung and pleura, the lower two pieces related to the pericardium. That means when you are drawing the posterior relation of the pleura on the left side, you cannot draw this line vertically. It is wrong. Why it is wrong? Because you know that on the left side you are having this presence of a cardiac notch. So when you are drawing the pleura, you have to draw it like this. Clear? And then it will go down. So this area, now this area is related with the pericardium. So this is an important concept to keep in mind, that when you are drawing the posterior relation of the sternum, you cannot draw the pleura on both the sides as a vertical lines, because on the left side this pleura will show a deviation for the pericardium, and this pericardium is related here with the sternum posteriorly. Clear? So here you can see that this is what I am talking about, that this is your mediastinum area, that is the midline area. Now here you can see that this left border is going downward as a cardiac notch. Now this reflection is important to understand because on the right side it is vertically straight, but on the left side you have to keep this deviation in mind because this area is occupied by the heart and pericardium. So here in this video clip you can see that this is your manubrium, this is your body of sternum, and if you will remove these areas you are able to understand the relation. Now inside that you can see these transparent membranes which are the pleura, and if we will remove this sternum, what you are able to understand that this sternum is having a relation vertically downward on the right side, but on the left side you have to keep in mind that this is a deviation is present, and this deviation is there because of the cardiac notch. Clear? Now we will move to the lateral borders of the body of sternum. Now when you will see the body of sternum means from this junction between the manubrium and this body to the junction between the body and xiphoid process. Now from here to here what you will find, there is a complete facet for the third costal cartilage, fourth costal cartilage, fifth costal cartilage, sixth costal cartilage. But in upper part you will have the half facet for the second, and here you will have half facet for the seventh. So you have 1, 2, 3, 4 complete facets on the lateral side for the costal cartilage, and you will have half and half, means 2 demi facets for the second and seventh costal cartilage. So there are 2 demi facets for the second and seventh costal cartilage, and you will have 4 complete facets for the third, fourth, fifth and sixth costal cartilage. And as I already told you that the junction between the first and the sternum is a primary cartilaginous, while these remaining are your synovial joints. So this is again a question for your exam. Now between the facets, the lateral border of your sternum provide attachment to the muscles of chest wall, that is external intercostal membrane, and deep to that you have internal intercostal. So we know that here in this gap, now if you will see this gap, now between the 2 ribs you are having the intercostal muscle, and in my class of your anterior chest wall muscles I told you that from this junction of the rib and the costal cartilage you are having the muscle is known as external intercostal. And after this gap, this is filled by a membrane which is known as external intercostal membrane. So this external intercostal membrane also attached to this lateral border here between the adjacent costal cartilage. Now deep to this external intercostal you will have internal intercostal, and we know that internal intercostal start anteriorly as a muscle and posteriorly it will have the membrane, while external intercostal anteriorly has the membrane and posteriorly it is muscular. So dear students, in this way this gap between the adjacent costal cartilage on the lateral border of the sternum you will have the attachment of external intercostal membrane and the muscular fibers of internal intercostal muscle. Now when you will move to the xiphoid process, now you have to keep this thing in mind that xiphoid process is also known as xiphisternum, or it is also known as metasternum, or sometimes it is known as ensiform cartilage. Clear? So these are the few names for your exam, that is metasternum and ensiform cartilage. So this is the lowermost end of your sternum which is known as xiphoid process. Now it is the lowest and the smallest portion which we know, and it is having the 2 surfaces. This is anterior surface and deep is the posterior surface. It is having the 2 borders. You have this left and right lateral borders, and it is having 2 ends. This is the upper end and this tip is known as lower end. So what are the relations on the anterior surface of the xiphoid process? Now this anterior surface of xiphoid process related with the muscles of anterior abdominal wall, that means it give attachment to the rectus abdominis and aponeurosis of the external and internal oblique muscle. So you know that this is your anterior abdominal wall muscle, this is your xiphoid process, and here you can see this is the muscle which is known as rectus abdominis, which is having origin from the lower end, and when it will go above, its insertion is on this xiphoid process anteriorly and adjacent part of the ribs. Along with that, it is also having the aponeurosis of your external and internal oblique. Not the muscle, it is aponeurosis. Now, what are the posterior relations of the xiphoid process? Posteriorly, you know that you are having a diaphragm which is separate the thoracic cavity from the abdominal cavity. So, some fibers of the diaphragm also arises from the posterior surface of the xiphoid process, and again you will have a muscle is known as transversus thoracis, which is the innermost part of the intercostal layer. Then this xiphoid process is related with a organ is known as liver. Now here you can see that this is the xiphoid process, and deep to the xiphoid process here you can see this big organ, this is your liver. So liver is come in contact with the posterior surface of xiphoid process. Now what about the borders? You know that it is having the two side borders. Now these borders also give attachment again to the aponeurosis. It is not to the muscle, again I am saying this, it is the aponeurosis, and these are the two inner layer of anterior abdominal wall, internal oblique muscle and transversus thoracis. The superior angle possesses a demifacet, which I already told you that this is the 7th costal cartilage. Half of the costal cartilage attached on the lower end of the body, and half of the costal cartilage attached on the side of your xiphoid process. Now what about the end? It is having upper and lower end. Lower end is your tip, and this tip is having an attachment to this thick band in the midline of anterior abdominal wall is known as linea alba. So this linea alba will go and having an upper attachment on the lower end of your xiphoid process. Now what about this upper end of the xiphoid process? This upper end of the xiphoid process making a joint with this body of the sternum, and this is known as xiphisternal joint. What is that? Xiphisternal joint. So upper end is known as manubriosternal, lower end joint is known as xiphisternal. Now this xiphisternal joint usually ossify. Ossify means synostosis occurs at this joint by the age of 40 years. That means this joint ultimately convert or ossified, and it is becoming permanent with the body. Clear? So these are the important things which you have to understand when you are holding the sternum in your exam. That what are the parts of the sternum? Manubrium, body, xiphoid process. Then you should know the most important thing is that how many costal cartilages articulate with the sternum. So you have to understand is it is 1 to 7, and the difference is that the first joint with the sternum is a primary cartilaginous, remaining 2 to 7 are the synovial joint. The another most important difference is what is sternal angle. Sternal angle is a junction between the manubrium and the body, and the last and the most important is what is the posterior relation of the body, because the right side you will have the complete relation with the right pleura, but on the left side you have a deviation because you have the relation with the pericardium. So this is all for the session. Thank you.